Hello, good evening, and welcome to session 14. And yes, today we'll be talking about the big boss, the brain. Right before we start, right, the official disclaimer that all the images displayed during this medical training session are for education purpose only. And not all images are suitable for audience of all ages. All right, so let's start with the brain. Now, see, before we really start, right, three things we'll understand because it would help you a lot. One, as always, will not try to cram anything, right? So it's like there would be images from almost all the planes, from x-axis, y-axis, z-axis. Will take transverse section, longitudinal section, all sections. But what we really need to create is the 3D picture of brain. That would be my attempt. That is, by the end of our today's session, you should be having a very clear idea that this is how the all the structures in the brain they are lying. Second, we shall be discussing all 12 cranial nerves today, right? But these nerves will not be following their course. We'll just see that from where exactly are they coming out and where they are going. So today also we'll be talking about that. Okay, this is the dura mater, right? And then this is the middle cranial fossa and all the things they are going underneath it. But then they'll be going into their respective foramen. That is all those bony foramens. So this is where we'll look at the emergence, from where they are emerging, right? That's what we'll see. Tomorrow, cranial number 1 to 6 in depth. So at that point, again, the emergence of all those things will actually be coming. But if you understand this thing today, tomorrow will be much easier. And the third and the most important thing, we'll study everything with respect to a structure. And that structure is the ventricular system, right? That is the ventricular system. Ventricle means a container which is consisting of some fluid, right? So over here, we are talking about CSF, cerebrospinal fluid. So instead of straight away jumping on, okay, this is cerebrum, this is cerebellum, no. What we'll try to do is, we'll see the ventricular system and then we'll start recreating one by one the structures, and then we'll correlate everything, right? I was live sharp at 7:30. You're talking about today? I was live sharp at 2:30. It should not start in the middle. Anyway, you have not missed anything. Say, that's what I was talking about. So you just missed the disclaimer. Okay. Anyway, so the thing is, this is what I was planning. This is our action plan for today. That's our action plan. That instead of just talking about or showing one image and enumerating that this is cerebral peduncle, this is superior, this is inferior, this is middle. No, we won't do like that. Our intention is to create the 3D picture of the brain into your brain, right? Then we'll be talking about 12 cranial nerves. That is, from where are they emerging, right? Tomorrow we'll be talking about in-depth cranial nerve 1 to 6. Day after tomorrow it would be from 7 to 12, right? And third thing is the ventricular system. So that's what I was talking about, that this is a system which is responsible for the CSF creation, cerebrospinal fluid creation. It creates, and that it moves from one ventricle to another, right? And then all the way into the spinal cord. And the idea is, we'll learn the entire brain with respect to this ventricular system, so that it would create a base on which we'll keep on mounting the structures one after the another. So these are the three intentions, right? All right. Chalo. So let's start with Again, something which is known to us, and we know it very well that this is cerebrum, right? Cerebrum, right? And this one would be the cerebellum, right? Chota dimag or the small brain. No way it's small. And this section, that is what we call as the brainstem, right? And in brainstem, there are three things. There would be midbrain, right? Then there would be pons and the medulla. Because it is oblong shaped, so that's why it is also called as the medulla oblongata, right? Oblongata, oval shaped. Okay. Today there will be lots and lots of interesting names, right? Very, very stylish names. Okay. So this is just another view, right? This is what, again, every time I'll keep on writing that which view are we going. So accordingly, you keep on adjusting. And in case if you lose the track, what I mean to say, losing the track means if you lose the reference that which angle is this, you lose the orientation, immediately let me know, right? So this is like anterior view, correct? We are watching from the anterior side. This is our anterior view, which is showing two cerebral hemispheres, right? So that is right and left, and that's the brain stem, right? Brain stem, right? I mean, oh, the entire one. Okay, this entire thing. Now to this, you see, I have overlapped a figure, right? There is something which is over here, right? This is ventricular system, right? This is the ventricular system. Now for brain which is of the size of say 1500 to 1600 grams, right? 1600 100 grams. It requires CSF, cerebrospinal fluid, right? So it is cerebrospinal fluid. Long comment. Uh, okay, all right. So from tomorrow, I'll start 2 minutes earlier. Possible. It might have happened because I started at 7:29. So it might have happened that because of some delay in the servers, right? The initial portion might have been skipped. From tomorrow, I'll start 3 minutes earlier so that we are ready by sharp 7:30. Okay. So coming back to this, that this cerebrospinal fluid, right? That is what is needed. Now, this fluid, actually, if you look at the amount, it is very less, right? Against 1500 grams of brain, this cerebrospinal fluid is about, say, 150 ml. And this 150 ml is once again divided into, say, 125 ml and 25 ml, right? Immediately we can jump that, okay, yes, this 25 ml and this is 125 ml. So 125 ml must be into these ventricles. They look so big. No, in fact, it is the subarachnoid space. Now you know it very well, subarachnoid space, right? So just underneath the arachnoid. So that subarachnoid space is having 125 ml, and such big things which we are watching, that is having only 25 ml of fluid. So that is into ventricles. But this is so important. The CSF is so important. It has got so many functions, right? If we say, so what it really, one most interesting function is what is called as the buoyancy. Buoyancy. The fluid is everywhere, right? And then that fluid is creating a tension in which the very soft brain is lying. So because of this buoyancy, it is acting as a membrane, right? As a stretch membrane in which the brain is lying. And that leads to a very effective thing, what's called as it acts as a shock absorber, right? This acts as a shock absorber. Because when we'll see the implementation, especially in boxing, that coup and counter coup mechanisms, or in accidents, then when sudden brake is applied, and then when the head goes in front, right? But the brain tries to remain into its same position, so it is like the occipital lobe that is dashed. Now that is where the visual cortex is there, so suddenly it leads to all those fainting effects, right? It is really very interesting. Once you understand the entire brain, its implementation is superbly interesting, right? Then what else? Say a very standard thing, nutrition, right? Nutrition, that is what is provided by this. Then say immune system, right? Immune reactions, that is for the immune function. This is also because it is having immunoglobulins and those mononuclear cells. And on top of it, this is what is called as the homeostasis, right? This is a very nice word, homeostasis. Homeostasis means everything should be balanced, right? So that it is the CSF which takes care of temperature, which takes care of pressure, right? And that's the reason that for many of the diagnoses we do lumbar puncture. When you do lumbar puncture, you find that pressure is more, right? There is raised pressure. So that means there would be so many diagnoses associated with it, right? So temperature, pressure, all those things, they are, so these are like functions of functions, right? These are the functions of CSF, cerebrospinal fluid. Now this fluid is generated, is secreted. So these are the ventricles, right? These are the ventricles. We'll be going into the detail of these ventricles, but there are few special cells in it. Actually, in today you'll be watching not less than 70-80 images, right? And everything, whatever we are talking about, will watch it, because deliberately today I have not kept any of the diagram. All are real images, all are real images, because diagram is okay, it is good to label, but once you understand the concept, it would be, you'll be very happy with yourself. Okay, so this is what is called as the choroid plexus, right? Choroid plexus. So it is this choroid plexus which would secrete CSF. And why should they secrete? Because there are special cells, right? Those cells which are called as ependymal cells, right? Do remember ependymal cells. And when we'll be talking in depth, I'll tell you something which is very interesting, right? Ependymal cells. Okay, so they keep on working for entire day. That means they work for entire day and they create about 400 to 600 ml of CSF. So much, because as such, so it is about 150 ml. It is creating almost 4 times more, right? So that means it would be absorbed also. Exactly. So this CSF, it's like a constantly produced and absorbed, right? And see at what rate, right? So it is pretty fast. Okay. So these are like we understood that this is our ventricular system. Now let's see this ventricular system. This ventricular system, this is the CSF system or the ventricular system. It has got lateral ventricles, right? This is easy to understand, right? Lateral ventricle, because it is on both the sides, laterally situated. So lateral ventricles. Now these lateral ventricles, they open, right? This opens and this opens into this very, very thin. It looks like that it is a tube, but when we'll look from other projection, you'll find that it is, though it is a flat structure. So over here, at this point of time, we say that it is a flat structure. Yes, it is a flat structure, but its surface area is more. So when we'll see from other aspect, right, you'll find that it is big. So this is also a ventricle, and because say lateral ventricle, so this is one, this is two, so we have to call this ventricle as third ventricle, right? So there is nothing like first and second, because two laterals are there. So whosoever you want to give number one, number two, and then that is the third ventricle. Now this third ventricle, it opens into very logical. This is another one, that is the fourth ventricle, right? That's the fourth ventricle. So that means we are dealing with four ventricles, and it is this fourth ventricle where from the lateral side, from the medial side, that is where it would be opening into all-time great subarachnoid space, right? So Thus, lateral ventricles produce, they go into third ventricle, from there it goes to fourth ventricle, and then from the lateral side and from the medial side, it goes into the subarachnoid space. You will actually see each and every foramen, where exactly are they located and how they work, right? But this is how the plan is. Now let's go into more detail. Here it is. We are watching it from another angle, right? Immediately you'll find that lateral ventricles, they are easy to diagnose, right? Easy to figure out. So that's the lateral one, right? This is the lateral one, and this one is from other side, this one. But both of them, they are opening into, see, this is the flat structure. Right now, see, it is as such a bigger structure, right? So this is third ventricle. That's what I really wanted to emphasize, that it is such structure. And yes, this one is fourth, so that you already know it, right? So we have understood this part. Now you can see one thing very clearly, that it is this portion that is pretty thin, right? That is pretty thin, right? It is like a duct, right? It is like a duct. So just keep in mind that yes, it is. And then you will see that yes, there are few projections, something going like this. Yes, all of them, they make sense. So let's see a complete lateral view, right? This is a lateral view, right? This is a lateral view. Now this lateral view will make so many things pretty easy. Say this one is lateral ventricle. Right? Now we are introducing new names. This lateral ventricle, we said that it opens into third ventricle. So schematically, if you see, so this is lateral, right? This is third. So this opens here, this opens here. Then this is fourth. And through fourth, it goes into the subarachnoid spaces, right? So now we are talking about these foramen. This, correct? These foramen. So which foramen is this? It is here, here, right? That's the foramen. So this is the foramen which is between lateral and it is opening into third ventricle, correct? It is opening into third ventricle. Now from lateral to third ventricle, that is what is called as the interventricular foramen. No fun, right? This name is very simple. We need to give some interesting name. So it is called as lateral foramen of Monro, right? Such superb names are going to come, right? So this is called as interventricular foramen of Monro. All right. Then this is what? This is a duct. Yes, we talked about it. No? Duct. And this duct is between whom? This is third and this one is fourth, right? So between third to fourth, this is duct, right? So it is cerebral because it is carrying cerebral fluid, right? So this is cerebral aqueduct of, again, we need to give some name. So this is called as Sylvius, right? So it is cerebral aqueduct of Sylvius. Now this cerebral aqueduct of Sylvius, whenever this comes, this name comes, cerebral aqueduct of Sylvius, there is one speciality. As we said that there is choroid plexus, right? Now you know choroid plexus. It is where it is having which type of cells? Ependymal cells. They will be secreting what? They will be secreting CSF, right? Now we'll actually see that these choroid plexus, they are present, right? They are present into this third ventricle. Then from third ventricle via interventricular foramen, they actually go into the lateral ventricle. So lateral ventricles produce CSF. Third ventricle produce CSF. Spinal cord, right? Over there also, there are say these choroid plexus, right? Ependymal cells, they will produce CSF except cerebral aqueduct of Sylvius, right? In this, there is no choroid plexus. So do remember this, right? That there is no choroid plexus. Okay. Now, correlating it. Over here, see, we talked about some important foramen, right? That was interventricular ventricular foramen, as foramina, because it is on both the sides, right? And that was, name was Monroe, right? Foramen of Monroe, and it was from lateral to third, correct? Lateral to third. Then second was what? Cerebral aqueduct, right? Cerebral aqueduct, and its name was Sylvius, cerebral aqueduct of Sylvius, and it was from third to fourth. Then again there is one more foramen. As we said, right, that this is the fourth ventricle, and one from the medial side and two from the lateral sides. That's what they, where they open up into. They open up into that subarachnoid space, correct? Subarachnoid space. So the thing is that in the fourth ventricle, right, that is where would be a median aperture, right? That is what is called as the median aperture. And that median aperture would open from fourth to subarach space, right? And then there would be two more, right? That is the lateral aperture on both the sides, right? On the both the sides. And again, that would be from fourth ventricle to subarach or the subarachnoid space. We put some space in between. You must have guessed. We'll be giving some name, right? This is M for M. It is called as the foramen of Magendie. Foramen of Magendie, right? That is for fourth to subarachnoid space, but there is one opening. And this is like right and left, and L for L, and this is called as foramen of Luschka, Luschk. Interesting names, ne? Right? Foramen of Luschka, foramen of Magendie, cerebral aqueduct of Sylvius, and foramen of Monroe. As such, you have seen all, except some these small things, right? We'll come to that. Okay. Now see over here, that's the brainstem, right? This one is brainstem, right? This full one, that is a brainstem, which is consisting of medulla oblongata, bones, right? Here it is. So this is, say, medulla, then there is bones, and the midbrain. All three of them collectively, they are called as the brainstem. Brainstem. Now this brainstem, where exactly it is located? Now you know occiput so well, right? Occiput so well. And we said that occiput is where occiput is in front of the foramen magnum. Now that is very obvious that this is something which will be passing via foramen magnum, right? This is foramen magnum, that's where it would be passing. So this, it has to be here, it has to be occiput. So not at all difficult, right? And then that occiput, it was taking upward turn, right? It was going up, and then there was one another structure, and that was called as the dorsum celli, right? Dorsum celli, that Turkish, right? So sella turcica and then the dorsum celli, right? So it means it is this portion which is anterior and this portion which is posterior, right? Fair enough. This is our cerebellum, right? And the cerebrum is above. So the point is that the brainstem, it lies behind, right? It lies behind basi occiput and sella turcica. So these structures will be right in front, right? Okay, moving further. Now we have isolated it, right? This is only the brainstem what we are watching. So it means this brainstem is connected with whom? It is connected with cerebellum, it is connected with cerebrum, right? It is connected with cerebellum and cerebrum both. So how come it is connected? Easiest thing to see, what we really immediately, first thing which we see is that this is the huge one, this is the huge one, right? This big area. That big area is none other but this is cerebral peduncle. Peduncle, right? These are the big peduncles, these are the big structures which are connecting the regions. Fair enough. And then there is such big structure which is over here, and that one is called as the cerebellar peduncles, right? So one thing is very clear that now the brainstem is there. There are cerebellar peduncles for the choda brain, that is the cerebellum, and then the big brain which is sitting on the top. So for that it is a wide area. So this is a cerebral peduncle. Fine. Now this is to see this thing, it is on both the sides, right? This is the opposite side. We are watching it from the side. That means this side is anterior, right? Just the orientation. This is anterior. This one is posterior. This one is posterior, right? What it would be containing? Basically, this will consist of tracts which will be connecting cerebrum, cerebellum to the spinal cord, because everything is as such going via the spinal cord, right? Because then the spinal cord is distributing it to the entire body. Why this brain is big boss? Because here all the highways are there, right? Big tracks, they are coming and they are constantly telling that acha ye suna, ye dekha, right? All those things, they are coming over here. So this means that it would be consisting of tracts. And these tracks, they are connecting cerebrum, cerebellum, and the spinal cord, right? Spinal cord. Now see, neurophysiology becomes exceedingly easy once you know the circuits well. So immediately it will become so logical that when this thing is cut, yes, this path will not function, right? Same way. So this is one thing. And second, this would be consisting of few nuclei. And these nuclei, they are for autonomic nervous system. One of the important one, that is in the medulla, right? The medulla. Medulla is having that respiratory center, right? Respiratory center. And this respiratory center, which controls the respiration. Otherwise, every time we have to remember, ke chalo yaar, breathe, breathe, right? We don't have to remember that. It is an autonomic function. Unfortunately, it is this medulla, right, which is extremely sensitive to hypoxia. Hypoxia. So whenever there is any hypoxic attack, say for example, myocardial infarction, this medulla is affected first. So it means it affects the respiratory center. Once the respiratory center is affected, even if rest of the brain is functioning, but that respiration is extremely compromised and it can lead to dangerous results. Third important thing which we'll see in this case is, here there will be origin of all 12 cranial nerves. That's right. In this much, from this much area only, all 12 cranial nerves, they'll be emerging. So that's where we'll see them carefully. right? Okay, so here it is. Now this is like a posterior view, right? This is like a posterior view. So that's a posterior view. Now see, in posterior view, this is at foramen magnum, this will be continuing as a spinal cord, right? So this thing will continue as spinal cord past foramen magnum, correct? This area, right? What you are watching over here, this, the deep space, that is floor of fourth ventricle, floor of fourth ventricle. So what was fourth ventricle? That means fourth ventricle is somewhat situated like this, right? This is anterior, this is posterior. We are watching it over here, so that's why we are watching this area. That is floor of, this is floor, right? That is floor of fourth ventricle. Fine. And this is the medulla oblongata, which is a cone shaped or oblong shaped, right? Oblong shaped medulla. We are watching the posterior portion. Okay. Now we start rotating it, right? We start rotating it. It means at this point over here, remember this one would be, it is now going towards posterior. This is anterior. Okay? This is anterior. And now we can watch these cerebellar peduncles very nicely, right? See the big ones. That's the big one, right? They are cerebellar peduncles. I said cerebellar peduncles, right? Not cerebellar peduncle. Yeah, because say this cerebellum, right? Cerebellum, it is connected with everyone. Here is midbrain, here is pons, and here is medulla oblongata. So with midbrain, this would be superior, this would be middle, and this one would be the inferior cerebellar peduncles. So thus this is consisting of superior, middle, and the inferior cerebellar peduncles, right? Now watch for some more structures. There are two important things, and you'll understand its importance after some time, right? Just after a few minutes, maybe after about half an hour. Watch for that this is the posterior thing and very fine, right? Such nice soft tissue is over there, right? This is quite soft. This arch of tissue, which you are watching over here, right? Just do remember its name. This is what is called as the inferior medullary vellum, right? It is like a sheet, a thin sheet. Now, if it is inferior, that means there must be superior also, right? Otherwise, we would have called it only medullary vellum. Well, exactly. Here it is, over here. That's the portion which is called as the superior medullary vellum, right? So this superior medullary vellum and the inferior medullary vellum, what they will be forming? They will be forming upper part of the roof, that is roof of the ventricle. So where have we drawn? Okay, let's draw it again, right? Say this was the fourth ventricle. So over here, this is superior medullary vellum, and over here it will be forming inferior medullary vellum, which will be forming the roof, right? That is how it is arranged. So where this was a sort of, sorry, I think we drew it ulta. We drew it ulta. Let's draw it again. Let's draw it again. See, right over here. Got it? So, oh, oh. So that's the superior, and this is the inferior medullary vellum, right? Superior and inferior medullary vellum, right? Same here. Okay. Now we are watching it from the side, right? So this is in fact the anterior portion, right? Over here we are watching this anteriorly. Can you appreciate this round structure, round one, and then these are like bulge with this central depression. I'll erase it now so that you can see it properly. So these are what's called as the pyramid, a very important structure when we'll be talking about the physiology, right? Pyramidal tracts and non-pyramidal tracts, very important. And this one, right, this is what is called as the olive. This is called as olive, right? So this is on the anterior, or you can also say a ventral surface, right? Ventral surface. If we go into more detail, this is what, the moment we see these vellum, we know that this is a posterior one, or right, that's the posterior or the dorsal surface. Now that should be very easy, right? This is the dorsal surface, and opposite side is anterior. It means that all these structures which are coming out, they are from the lateral aspect, exactly, right? They are coming from the lateral aspect, and they are our all-time favorite cranial nerves, right? So let's start with that. But this process, this is ulta. This is ulta. We'll be starting with 12th cranial nerve, and then we'll be reaching towards the first cranial nerve, right? So over here, this one, that is hypoglossal, right? This is hypoglossal nerve. That is 12th, right? Above that one is vagus. That is 10th. Where is 11th? Here is 11th, right? It is this cranial part, because it has got two parts. So this is the cranial part of 11th cranial nerve, right? That is accessory. So this is the 11th one. So here it is 11th, that's the 12th, and this one is 10th. They are easy. Can you appreciate one more now, which is coming over here, right? See, this is where it is going, right? So that is, as you must have guessed, number 9, glossopharyngeal, right? This is glossopharyngeal. So that's how they all are emerging 9, 10, 11, 12 from the sides. Well, this was okay. But if we really want to enjoy it, we need to see that inside the skull, how exactly are they placed? And this is what is needed. Now see, orient yourself for this figure first. Why the numbering sequence is inappropriate? Well, it is not inappropriate. Right? Actually, you'll find that right from the first, the order in which they are coming out, that's how the numbering is there, right? The order in which they are numbering out. So when we'll see that all the way from 1 2 3 4 5 6 7 8, right, you'll find that they are coming exactly into that order, right? That's why there is nothing like grouping that this is sensory, this is motor, that's why it is number 4, number 5, nothing like that. They are just simple, the order in which they are coming out from the brain, right? Okay, now see, this is the most important figure. This is the figure which will explain so many things, right? So this is like a bird's view. Right? This is like a bird's view. What we are trying, we have opened the skull, we are watching from the top, and then we remove two things. We remove tentorium. Yeah, it was necessary, right? If the tentorium is there, we won't be able to see this foramen magnum and the brainstem, right? They cannot be seen. So we remove that. At the same time, exactly on top of it, there would be cerebellum. So we need to remove the cerebellum also. So that's what we did, right? In this specimen, just imagine we removed two things, cerebellum. See, this is the divided cerebellum, portion of cerebellum, which is on, right? A small portion. That's a divided cerebellum, which has been removed. So here it is, what we are watching, say deep it is going, that is what, that is the brain stem. This one is the brain stem. That's what is going down as spinal cord, right? And such, this big structure, big white structure, that is peduncle, because we cut down the cerebellum, so obviously the cerebellar peduncles will also be going, right? So that's why it is this. So now if you just put the cerebellum, right, this pedicle, this peduncle, not pedicle, peduncle, that would be in process. So this is the cerebellar peduncle, which has also been cut. Okay, right? Now see this cerebellar peduncle. We do you watch some nerves, right? Yes, we do watch. See, here are the nerves, some nerves coming out, right? So let's zoom this thing better, right? Now we see that yes, these are the nerves. When we see these nerves, you try to recollect which foramen is this. Immediately you will shout with full throttle that this is foramen magnum, right? Foramen magnum. And then in bones we saw that then when the foramen magnum is there, then there are two other massive foramens, big one, right? No way they can be compared with magnum, but still bigger foramens on both the sides. They were what? Jugular foramen, correct? This one, right? Let me change the color. Yeah, this one, right? They were just on the side. So this is like jugular foramen, jugular foramen. ठीक? Bus, this much is, should be known to you. Now see the fun. Same thing, right? Same thing copied, but we have just pushed the brainstem slightly up so that we can see the things much properly. Because we need to understand two things over here. One, it is the jugular foramen which is conducting so many things, right? But the first thing first, let's pick up that, okay, this is again the same area. It is the same area from where all those cranial nerves were coming out, right? So now, but now they are going out, right? So let's follow them. This one, this one, right? This we are picking up first because this is none other than number 12, hypoglossal, right? It is hypoglossal nerve. Now this hypoglossal nerve will come out of the cranium from the skull, right? Via one dedicated canal, and that was called as the hypoglossal canal, right? Hypoglossal canal. So that's it. This thing is hypoglossal canal. This one, right? It is hypoglossal canal. So absolutely reserved for number 12. Okay. What about others? See, so many nerves, they are all trying to reach to this foramen. Yes, now we know this name, right? This is a jugular foramen. And if you are, say, if you are revising the things properly, immediately you'll say that it is this jugular foramen which is a common opening for 9, 10, 11, right? This is the jugular foramen which is common opening for cranial nerve 9, cranial nerve 10 and cranial nerve 11. This is a common opening, right? So where exactly are they? Here it is. First, so it was 12. So let's figure out where is 11. That is 11, right? So all the way it is coming from down, and this one figure is becoming messy. Let's write on other side. Here it is. Yeah, this one would be better. So this is 11, right? Accessory. So that is 11. Vagus has to be big, so there is no problem in identifying it because this is the thickest structure, so that is the vagus, right? No problems in that. Thickest one, big structure. And a very delicate one which is going over there, only left out is ninth, and that is glossopharyngeal, right? Glossopharyngeal. So that's how our journey would start. Tomorrow our journey would start. It's like from this point onwards, say we'll be picking up one now, no doubt tomorrow. So we are talking about 1 to 6, right? This thing will come day after tomorrow, but every nerve would be, say, discussed like this from starting point, as it emerges, then where it goes, and we'll trace it all the way, right? So this is clear that when we take the brainstem on one side, we see that yes, 9, 10, 11, never forget that they are going out by a common foramen, jugular foramen. For 12th, there is hypoglossal canal. I received one mail, not yesterday, but about last week, that how to remember the structures what are coming out of all these foramen. I said just wait for a few days. After discussion of cranial nerves, you won't have to cram anything. Actually, you will be able to visualize that this is how the whole structure is assembled. You'll start appreciating God, that what a marvelous piece of creation, right? The brain is. Okay, right? So this part is good. Let's move further. Okay, now see, I have tried my best to show you some of the nerves, but they are actually so delicate, so small, that I will try to appreciate it by zooming out this figure. Okay. Now see, this is medulla oblongata, right? I'll write and then I'll erase it, right? So that we get space to write interesting things. So medulla oblongata, and on top of it, this is pons, right? You know this now. So let's remove this part. Now this is like a groove, right? So this is a groove between what? Pons and medulla oblongata, right? So let's remove that line also. And now I'll zoom this figure. Three interesting nerves, they are coming out of it, right? We'll try to see it from other angles also. But can you appreciate that just from the groove, right? This is one nerve. I'll outline them so that you can appreciate it. So this is one nerve because the ends are cut, right? Here the ends are cut. So we just see the emergence and then we'll see them actually into the skull. So this is this one. We have completed how much? 12, 11, 10, 9. So this is 8th, right? This is 8th. And 8th one is vestibulo cochlear. Vestibule, vestibulo cochlear, sorry, right? And then comes a beautiful nerve, this one, right? They look so small, but actually their functions, they are so big, right? This one, this is 7th, and that is facial now, right? And then a small nerve which is coming, right? I need to draw just like this, right? A small one, right? It travels exactly into the groove, right? Into the groove. Say this one, this one. Let's unzoom it slightly so you can actually watch it, right? See this thing, this. Now erase it, right? So that is number 6, abducent, right? So that's how facial, vestibulocochlear, and the abduction 6, 7, 8, right? So yes, tomorrow abduction will be invited, right? Because we'll be discussing that now. So we talked about from 12, 11, 10, 9, 8, 7, 6, right? 5 to go. The deadliest now, right? Tomorrow you'll feel the heat. Yesterday also said you'll feel the heat of this now, and this is trigeminal. Trigeminal, right? The fifth one. If any nerve can harass you in exam, it is the trigeminal nerve, right? Because it has ophthalmic, maxillary, mandibular part, then ophthalmic is going via that superior orbital fissure, then middle one, I'm sorry, this, yeah, middle, but this is, it is like maxillary, that is going via that rotundum, then mandibular, that is going via foramen ovale, right? So that's how it is. And then even that's not the end. Even when they'll divide, and then they will be traveling into that alveolar canal and whatnot, right? So tomorrow almost 60% of our time will be going for this queen nerve, a trigeminal nerve, right? So this is the trigeminal nerve which is emerging from upper part of pons, right? So this is from upper part of pons, and beyond doubt she'll be the guest of honor tomorrow, right? No doubt about it, because it's so beautiful, right? Wonderfully dividing, and even today also we'll see a part of it. And here it is again. Orient yourself, right? Actually it is the same specimen, but we have just shifted the camera, right? I'll orient it properly. See, this is what, this is middle cranial fossa, right? Or we can write it in short, right? This is middle cranial fossa, right? So that's the middle cranial fossa. And we talked yesterday that in middle cranial fossa, when the dura is there, then there are no foramen, right? Not a single foramen. Yes, we can see that there are no foramen. Then what? Then say this is what, this one, right? That's the pons, right? That's the pons. And from there, these nerves, they are coming out. And one important thing, that what is between middle cranial fossa and the posterior cranial fossa, that was petrous temporal, right? So this is the petrous temporal, best, right? Petrous temporal. We always call that this is a very heartless structure, right? It is so rigid. Okay, so that is the petrous temporal. In petrous temporal, there are nerves which will be going into it, because there was what? Internal acoustic meatus. You remember that? Internal acoustic meatus. Okay, so can we see these two nerves over here, right? See these two nerves. They are number 7 and number 8. Facial and vestibulo cochlear. Correct? These are the two nerves. Okay, let's see still in more detail. So we have now pushed once again the pons and other structures on side so that we can see the things clearly. Now this is where we watch first thing, that biggest nerve is what? This is the biggest nerve. So that's the queen nerve, trigeminal, right? Let's draw it short. This is trigeminal, right? Trigeminal, number 5. And this trigeminal would be dividing into 3 parts, right? One is ophthalmic, right? Second would be maxillary, and third would be mandibular. These are the 3 divisions. So every time whenever it is written like say 5-1, 5-2, 5-3, that means we are dealing with ophthalmic, maxillary and the mandibular. So let's write it over here only. This is V 5-1, 5-2 and 5-3, right? With some space over here. Okay, so this ophthalmic division will be passing through. Not to worry, tomorrow we'll watch it, but right now we write it that it would be via superior orbital fissure, correct? Then this maxillary, that would be going via rotundum, right? All are foramen. So we are not writing foramen rotundum, foramen oval, right? So foramen rotundum, which was, remember, it was in the middle. And the posterior one, which was through which the mandibular portion was passing, that was foramen ovale, right? Rotundum was round, that's why it was rotundum, golu molu, right? And ovale was oval, right? It was oval. So that's how they will be passing. Now this superior orbital fissure is a big structure, right? Big space. So then this one, can you see one now over here also? Pretty delicate, right? That is abducent. Oh, can't read. I'll change the color. This is abducent. So this is number 6. Now this is such a small passenger. So it'll say, okay, no worries. As such superior orbital fissure, right? Trigeminal is going, so I'll accompany her. So this becomes another passenger for superior orbital fissure. So that is how they go. What about these two? Yes, we have already talked about, right? These two, that is facial, right? And the vestibulo cochlear, right? They will be going into this internal acoustic meatus. And this internal acoustic meatus, it is into that petrous temporal, right? Petrous temporal. So it will be passing into that bony, right? Rocky area, right? While these are all going via very sophisticated fine area. Trigeminal, though, it enjoys super luxury, right? So that's how, say, they'll go. So facial and vestibulocochlear, right? Number 7 and number 8, right? Number 7 and number 8, they are going via this rocky area, internal acoustic meatus, petrous temporal, trigeminal, abducent, right? They are going like this. Okay. Taking our discussion further. Now we are on the top part of midbrain, right? This is the midbrain. We talked about the pons and the medulla oblongata, right? Now we are on the top. So over here, things which we already know, right? Things which we already know, that was the superior. This is what? This is the peduncle, cerebellar peduncle. Sorry. Cerebellar peduncle. As we are discussing midbrain, so we'll deal with only the superior part. So this is the superior cerebellar peduncle, right? Because otherwise that middle one would go straight away, right? It is like a ramp walk. Straight away it will walk into the pons. And that inferior one will dip down because they'll be talking to medulla oblongata, right? Okay, so this above thing what we are watching is the beautiful midbrain. In this midbrain, there is one prominent area, right? These are bilateral, right, on both the sides. Then there is one more prominent area, right? So do remember their names. Do remember their names. Superior and inferior colliculus, right? Superior and inferior colliculus. And in between there is nice, right? This you can watch, right? That structure, this one is the pineal body, is the pineal body, right? So that's how this midbrain that is arranged, right? And just to recollect, right? This is what this is. This would be like roof, right? Roof of fourth ventricle, correct? That is the roof of fourth ventricle, and that's how it is, say, arranged. Okay, here it is, right? Much better, right? Seen bit more properly. This is completely a dorsal, right? Dorsal view or the posterior view. The posterior view. So we know this is pineal body, right? Superior colliculus, inferior colliculus. This is roof of the fourth ventricle. Everything said and done, but we are watching something extra over here, and that is a super delicate nerve. Super delicate, right? Here it is. Ah, so thin, right? So thin, right? Just this much. This one, right? This one. And that is, see over here on the opposite side, it is shown much better. See all the way it is going, right? This is much, much better. See all the way it is going, right? Now I'll erase it so that you can see it properly. Can watch it, right? See this and this, right? Okay, so they are, and this one, and this one. They are trochlear, right? Fourth cranial now. So that is trochlear or the fourth cranial now, right? We remembered that this is supplying those orbital muscles, right? And we remembered it like SO4, right? So superior oblique 4, that is supplied by. We remembered one more thing, right? That was LR6. So lateral rectus 6. So this is like sixth one will be supplying lateral rectus. Fourth one, fourth cranial nerve will be supplying superior oblique. Rest, all of them, they will be supplied by third, right? So becomes easy. So that is the trochlear, right? And this part we have now already talked. So this you can use it for the practice, right? So it is like midbrain is over here, and from here it spreads, and these are what these are like cerebral peduncles, right? We have already talked about it. Cerebral peduncles, peduncle, right, on both the side. Okay. So this again, this is just another view for this cerebral peduncle, just to show that how magnificent it is, right? Such a big structure, and how nicely it is connected to the cerebrum, because it has to. So many tracks will be coming and going via that part. Okay. Now this looks like brain, right? This looks like brain. So where are these cerebral peduncles, right? We were watching it so efficiently, such big ones, so important, so prominent. Where are they? They are bichara so deeply hidden, right? They are also quite shy structure. These are cerebral peduncles. Cerebral peduncles. Right? That's how they look like in intact brain, because they are largely hidden by these lobes, right? These lobes. Which lobe is this? Temporal, right? So this is the temporal lobe of cerebrum, right? That's cerebellum. Now see, we can't decrease the importance of these cerebral peduncles, right? They are so good. So that's why mercilessly we cut down whosoever was obstructing it, right? So first thing, temporal lobe, right? Temporal lobe of cerebrum, that was cut. Once that was cut, we need to see these peduncles. So we said, okay, cerebellum, you are also bye-bye. So cerebellum was also cut. And that's where we see this cerebellar, right? Cerebral, right? Cerebral peduncles, right? That's how those cerebral peduncles, they are seen, right? Okay. Way back, I told you one thing, that you try to remember the structures in one flow, right? One after another. We are trying to follow that part. So today when you go for revision, try to revise that how one structure is coming after the second structure. So now we have known these peduncles very well, right? So we know these cerebral peduncles very well. So why not to finish off the structures which are near these structures? So let's orient. Now the brain has been tilted. So this is like midbrain, right? Here is the pons. This is the medulla oblongata, right? This is all time spinal cord, right? That's how it is arranged. So this means the structure which we are watching, the first thing first, something which is going like this, something which is going like this, right? And there is so much associated with this structure, right? What you are watching, say thanks to this structure, that's why you are watching, because this one is optic track. This is optic track, right? Not the optic nerve, right? It is optic track. Now over here, this optic track, as will proceed, right? As will proceed, say it will meet the opposite optic track, and then they will form a place what is called as the optic chiasm. Optic chiasm. And then from optic chiasm, what is going out? That is the optic nerve, right? Number two, right? Okay. Now this optic track, it comes out from one's very specific body, right? One specific body, and this portion, remember, it is called as the lateral geniculate body, because tomorrow when we'll be talking about this nerve in more detail, this thing would come. So this is lateral geniculate body. So remember, lateral geniculate body is for vision, right? Is for vision. Now, if there is lateral geniculate body, there has to be one more, that is medial geniculate body, right? Well, this round structure, what we are watching, it is the medial geniculate body, right? I'll just write gen body, right? It is the medial geniculate body. So no confusion, right? Right? So that is medial geniculate body, because medial geniculate body is associated with auditory, right? So this is with auditory. So we learned few extra things in this. Now let's see it in from another angle. That's what, right? We saw that this is peduncle, right? Cerebral peduncle, cerebral peduncle. So this one opposite side is also cerebral peduncle. The classical thing is between two cerebral peduncle you will find one nerve, and that is oculomotor, right? That third one. See, so easy to see. Just you have to locate two cerebral peduncles. So this one is cerebral peduncle, this one is another cerebral peduncle, and that's it. This particular nerve, this one, and this is bit intact. This one, right? This one. Here it is. Yeah, right. That nerve. So they are. That's the third one. Oculomotor. Right. So that's the third one. And this is second. We already talked about it. And you are already watching. This is olfactory tract, then it will lead to olfactory bulb, and then there would be the first one, that is the olfactory nerve. We'll watch it. I'm just telling, right? See, we said that all 12 cranial nerves, they will be emerging from this area only. That's right. Right. So that is how it goes. So let's see. Yeah, this is much beautiful figure, right? Much beautiful image. The angle is absolutely dead. The base of the brain we are watching. So over here, see how nicely we can really see. In fact, it was I put it for that optic chiasma, but see this one and this one, right? So good, right? Now there is no guesswork. So between these are the peduncles, right? This is the cerebral peduncle, and over here and here, what you are watching is the third one, right? Oculomotor. I'm writing again and again because so that it is cemented into your brain, right? And this is what, that is optic tract. That optic tract would be associated with lateral geniculate body, right? Then there is a medial geniculate body. That medial geniculate body is for auditory, lateral geniculate is for optic tract, right? And both of them, and when in physiology we'll see, so there is like ipsilateral and contralateral fibers. So few fibers on the lateral side, they go like this, they go like this, and then these medial fibers, they cross, right? So it means at what point the lesion is, depending upon that the vision would be affected. So if it is like, say this is eye, right? And if it is said that see the vision, think of, if the lesion is over here, right? If the lesion is over here, so then the entire eye would go, right? That sided. But what if the lesion is over here? That means if you draw here, so it means the lateral side would go, and over here the medial side would go, right? So that's how the entire discussion, when we'll be talking about the visual pathway, it will come up, right? This was just to emphasize that that's how they are actually crossing. Okay, so you know the optic tract, we saw oculomotor, right? Optic chiasma is this, right? Where they crisscross, right? Where they crisscross, that is optic chiasma, and then it goes into what's called as optic nerve, right? This is number 2, the optic nerve, right? We talked about it. Okay. Same thing. So I'll just write practice. Right. Practice. I think this is also for practice. Yeah. Okay. We can add this thing. That's olfactory tract, right? That's the olfactory tract. And it will end up in what's called as the olfactory bulb. And then via those cribriform plates, those olfactory nerves would be entering, right? So that's how that is, say, number one, the olfactory nerve. Let's make thing still more interesting when we are watching from another angle. This one is corpus callosum. Corpus callosum. What corpus callosum is? It is like a junction between right and left cerebral hemisphere, right? So both of them, they are there. So here we have taken a complete midsection, right? So in this, what we are watching is this one, this one is the, say, midbrain, right? That's the midbrain. And this one is cerebellum, right? Cerebellum. And this one, right, that is the cerebral peduncle. So I'll just write it over here only, right? This is the cerebral peduncle. Right? So that's how it is. And this one is obviously the middle cranial fossa. So that's what we have removed. We have just removed the left cerebral hemisphere, right cerebral hemisphere, right? This is the right. We are watching left. So right cerebral hemisphere has been removed. Hemisphere has been removed. Now we'll cultivate on it. The portion in which we are interested, we have just zoomed it. We see two important things in this. One, those nerves, right? The first one, which is seen so nicely, that which is immediately between those two peduncles, and that one is over here, right? This is good. This is oculomotor, right? That is the third one. Very nicely seen, right? And then we can't miss this, right? That is optic. This is the optic nerve, right? This optic nerve will be going towards what? This will be going towards, see, as it will forward, it will go into the optic canal, right? It will go into the optic canal. You remember that optic canal, right? Those anterior clinoid process, and just underneath that optic canal was going, right? And that's the oculomotor nerve. And then over here, a very small, where we were telling every time, a very thin, very delicate nerve, this one, right? This one, that is the fourth one, trochlear. As such, it has to supply just one muscle, right? SO4, superior oblique 4. Tomorrow we'll see all these muscles with every nerve, every twig, where exactly it is going, right? So there won't be any chance of the guesswork. We'll actually see it. So this is superior oblique 4. So this is 3, 2, 3, 4. Say it's going to be a long session, so hang on. Okay, now we are watching cerebellum. So cerebellum, this is a wonderful structure which is meant for balance. So it means if anything would go wrong to this, it would start affecting the balance, right? It is also meant for coordination. And the most interesting thing is intention movement. Right? When you want to move at that point. So this is like an intention movement. This is that important structure is intention movement. So that's this one is the cerebellum. Another view, right? Posterior view. So that's how it is also divided into the two hemispheres. Okay. Yeah. Just for the orientation, as you know that this one would be the foramen magnum. That's the cerebellum. That's the cerebellum, right? This one would be the tentorium, and this one would be the cerebrum, right? The occipital lobe, right? Top one. And this one would be foramen magnum, you know that. Now see, this is where we have isolated it, right? So this is the isolated, lonely cerebellum. Now, see, there are so many fissures, right? All those grooves, there are so many grooves. But when you see one fissure, which is so prominent, right? And this one, which is this one, right in the middle, right? This one, that is called as the primary fissure, right? Appropriate name, primary fissure. So the structure which is in front of it, right? It is anterior lobe, right? So this one, this one, this one, this one, this one. This is anterior lobe. Now this anterior lobe is small relative to this larger posterior one. So this is all the way, right? That is the posterior one. So this is the posterior lobe, right? That's the larger one. Okay. Now this is which view? Anterior view, right? Because previously we saw the posterior one. This is anterior view. From its anterior aspect, all the structures are connected. So first thing first, this is what? This is that peduncles, right? Which peduncles? Cerebellar peduncles, right? Because right in front there would be brainstem, right? So these are cerebellar peduncles. And now this is the right time to say divide them, right? So we can change the color. So this is 1, this one is 2, and this one is 3, right? Immediately we'll say that they are superior, middle, and the inferior cerebellar peduncles. So this superior one, that would be connected to midbrain, right? This middle one, that would be connected to pons, and this inferior one, that one will be connected to medulla oblongata, right? So these are the two cerebellar hemisphere, and that's our anterior view. Fine. To this, now if we go back, right? If we go back, this is the posterior surface, right? So these are two cerebellar hemisphere. In between, the way there was, say, those cerebral hemisphere were connected. Over here, these cerebellar hemispheres, they are connected by what's called as the vermis, right? So it joins two cerebellar hemispheres, right? I'll just write hemispheres, right? And yeah, this is the posterior view. And this vermis, it continues all the way interiorly, right? Yeah, this one is one of the very fine image, right? It gives such clarity. See, we are watching the entire cerebellar peduncle, right? So here it is, and here it is, right? The superior one, this is the middle, and the inferior cerebellar peduncle. And in this, we just wanted to say one thing. We said that for middle, so it is like a ramp walk. Yes, it is straight away, right? Middle cerebral peduncle is straight away walking into the pons, right? So the middle cerebral peduncle, that continues with the pons straight away, right? Because of the level. Okay. Now in this image, what we have done is, as we are about to start with cerebrum, right? So we said bye to cerebellum for the time being, because this is very important structure, right? So over here we have said goodbye to cerebellum. Right? Now see this cerebrum, why it is important? You talk about vision, you talk about auditory area, right? Auditory system. You talk about speech, you talk about language, right? Smell, taste, everything to it is handling, right? Touch, memory, right? Memory, right? All those things, they are handled by the cerebrum. Very important. This is how we just watched that it has got two cerebral hemisphere, right? In between, this is which view? This is anterior view, right? Just from the look at the say brainstem, we found that this is the anterior. Between two cerebral hemisphere, in between, what do you get? You get that falx cerebri, right? Falx cerebri, partition a sharp partition which is there, and this is like longitudinal, right? It is longitudinal, right? Cerebral fissure, right? It is called as the longitudinal cerebral fissure. Okay. Now see, in this, you already know it, so that's why we'll go a bit fast. There are lobes, and all these lobes, they are associated with the bones with which they are associated. So obviously this one is frontal, right? Then this top one would be parietal. We are coming to exact demarcation of these lobes within few minutes, right? But very crudely, right? This is the occipital and this one is the temporal, right? That is how they are, right? Okay. Yes. From top, when we see, right, when we actually expand, we separate both the spheres, we watch this structure, right? Corpus callosum, right? All the way, right? All the way, you can see that right from the front to back, right? It is connected. Once again, we are coming back to same thing, right? This is cerebral peduncle, right? Cerebral peduncle. And say this is a busy area. This one is a busy area because this is the area which is floor of third ventricle. So now you recollect that there was lateral ventricle, right? Lateral ventricle, and then there was a flat structure, the third ventricle, and then cerebral duct of Sylvius, and it was opening into fourth, right? So it is like this. This is what we are talking about. This would be the floor of third ventricle, right? It would be floor of third ventricle. These are the structures which will be forming, right? Ventricles, so they are inside, but this is where it is, these are the structures which are formed. So that's why we need to understand it, that where exactly these ventricles they are. Now this brain image is looking like a big castle, very nice. And seriously, say today, so I'm not looking at the watch, but once we complete this now, right, I'll be keeping a separate session for radiology, so where everything would be explained and you will be finding ki, yes, it makes sense, right? This is corpus callosum, this is third ventricle, now this third ventricle is enlarged, right? Things would start coming automatically. You'll be able to pick up the structure, and yes, in MRI, so you will be able to see these things with super clarity, much better, because you can really control the images, enhance the images, and you'll be able to appreciate it much better, right? Okay. So where were we? What were we talking about? Ah, third ventricle, right? So in order to see the third ventricle, see, third ventricle is a midline structure, right? So we slice the brain right through the third ventricle, right? So because it is a midline structure, so that's where we see this third ventricle. This one, that's the third ventricle. So we just write 3, right? That's the third ventricle. Now you know rest of the structure, corpus callosum, and that's all those things. Need not write. You know, this is third ventricle. Let's zoom this thing. Okay, okay, we'll come back to that. Meantime, this is means I misplaced, means the order was slightly changed. Anyway, so this is like you know it. So I'll just put sulci and gyri, right? So these are for what purpose? Just to increase the surface area, right? To increase surface area. Because sulcus and gyrus, we talked about it. All those prominence, they are gyrus, and those dips, they are sulcus, right? And you know it very well, that pia mater that goes all the way into the sulcus, and then there is a blood vessel. That blood vessel will be outside the pia mater, right? And when there is a branch which will be going into the brain, it will carry that small sleeve of pia mater all the way into it. Arachnoid, that will be jumping from gyrus to gyrus, right? It will be just bridging it. It will not be going inside. Now see, there are so many sulcus, right? There are so many names. We are right now trying to keep the thing simple. In a way, watch for this first one, this one, this one, this one. This is lateral sulcus, right? It is a lateral sulcus, right? Very deep. Actually, it is very deep. But the importance of this sulcus is that this sulcus would divide that, okay, this is temporal lobe and this one is frontal lobe. Right? We need to understand one more sulcus, it is coming up, but that's how we divide both these, that clear demarcation that this is temporal, this is frontal, right? And if we really see, right, when we trace, so that one is lateral sulcus. See, so prominent. That is, it goes all the way, right? It goes all the way. Here it is, right? That's how the medial sulcus all the way. This one. So this is the medial end of lateral sulcus, right? Lateral sulcus. Okay. Yeah. Coming back to this figure, this is where we need to see. There is one sulcus which is so prominent, right? It will go all the way to the medial surface, right? All the way, and it will go deep. So if we really want to mark, we can instantly see that there is this one is starting going all the way to the medial portion, all the way. So he can be only one, and that is central sulcus, right? Very appropriate name, good name, central sulcus, right? So it is the central sulcus. This is the only sulcus which will be going all the way to the medial surface. Otherwise, everyone will go and they'll end at one point, right? They will go, but they will end. They'll go, but they will end, right? So this is one is the central sulcus. And now let's place that previous one, right, which was the lateral one, right? So this one was the lateral one, right? That one was the lateral. Now see, this is this one which is front, or let's write it over here only. So this is the frontal lobe, right? This one is temporal lobe. So the point is that there are clean-cut boundaries between, say, frontal and the temporal. However, for the parietal and the occipital, they are very arbitrary. They are not very well defined. So it is just like the continuation, right? And it is like this and like this. So then that's what it is like. Say this one would be parietal and this one would be occipital, right? So this is green is like these are bit arbitrary, right? These are arbitrary boundaries depending upon the bone, right? So they are just put. But however, for frontal and temporal, right, they are a clearly physical division. Sliced, right? And that's where we see that when we watch it from the medial aspect, right? Say that's where this is like frontal, then this one would be temporal, right? Because this one was the that little sulcus, right? Over here, and then dividing this. So this one would be the parietal and this one would be the occipital, right? All right. Now let's add those. So this is olfactory bulb, right? That is olfactory bulb that would be there, and from there the first one olfactory nerve would go, right? So this one would be olfactory tract. That one would be olfactory tract. Let's learn one more new word. This though is okay. This is the temporal lobe, right? We talked about so many times. This is temporal lobe. But there is a prominence, right? There is a prominence. And at this tip, and this is what is called as the uncus. Uncus, right? Now let me give you some reference of this uncus. This uncus is lying just above, if I say, tentorium incisor. Now you remember, right, that it was the tentorium incisor through which who was passing, through which that brainstem was passing, right? So that will be the opening. So it means this will be the opening, right? But that opening would be the bigger opening because a small portion would be covered by this uncus, right? That's the thing. That's the thing. So we'll write it over here that just above tentorium incisor. Incisor was opening, correct? It was the opening into the tent. So why this figure? Just essay, right? So here it is, right? That's the, once again, we are coming back to that lateral ventricle, right? We are coming to this lateral ventricle. So in which that CSF is there. See these lateral ventricles, the way they are going, right? And now you must be remembering that lateral, right? Then it was opening into third. So what was the name of that opening, right? Name of that opening was interventricular foramen of Monroe, right? Then third to fourth it was going. So this was aqueduct of Sylvius, cerebral aqueduct of Sylvius, right? Then this fourth was opening on the median aspect. So that was what? That was M for M. So it was foramen of Magendie, right? Foramen of Magendie. And then laterally it is opening. So they are called as the Lashka, right? Nice name, no? Right? Foramen of Lashka. So these are the names. We would like to see these foramen, right? because then it becomes much more interesting. So, and yes, these are all openings into subarach space. So first, let's understand this lateral horn bit more properly, because this is such an amazing thing, and you will see that how finely it is distributed, right? So this is just isolated lateral horn, yeah, lateral ventricle, lateral ventricle along with its horns, right? So that's what we watch. Horns, they are nothing like but the projection. So this is anterior, right? That's the anterior horn. So that anterior horn, that is into frontal lobe. So this horn can also be called as the frontal horn, right? If this is anterior, so then there has to be posterior. So very logically, this one would be the posterior horn, and this posterior horn, it has to be into occipital. So we can really call it occipital horn also, right? That's fine. This lateral one, so there is no choice, right? This is someone which is going on the lateral side. So this is what is called as the inferior horn, right? This is what is called as the inferior horn. Inferior horn, and in this inferior horn it is going below, so it will go into the temporal one. Temporal, right? So this rest of the area, it is called as the body, right? It's called as the body, and this body would be in parietal, right? How interesting. So it means there is cavity in every lobe: frontal, parietal, occipital, and the temporal. So that's the strike of this lateral ventricle, right? And it is on both the sides. So see, when we project it on, now it is so good, right? So this is frontal, this body is in parietal, right? This tail is in occipital, that is the posterior horn, and this inferior horn is in temporal. Perfect, right? So that's how it is distributed. Similarly over here, right? That's like a temporal horn, right? Or the inferior horn. So we call this inferior horn or the temporal horn. This image for that yes, it is going down, right? So these horns, other horns, they were at a height, right? This is going down, so that's why this is also called as the inferior one, right? Okay. Ha. As, as I said that we would like to see those foramen, right? So this foramen, this is this one, that foramen. That foramen is interventricular foramen of Monro. So that's where it opens. The foramen in which the lateral was opening into the third ventricle, right? It was opening into third ventricle. So that's where. So yes, this is so good. But say, let's zoom this, right? Because then it will really make a very good sense. So we'll look at one image. Meantime, we let's see some more details of it. Something which we already know. We'll go a bit fast. What is that? This is the lateral horn. We know this part, right? This is what, that is the end, that is lateral ventricle, right? Not horn. Lateral ventricle. This is the anterior horn, right? That is anterior horn. We know this part, and it opens into this third ventricle. Yes, and this is what, that is Monro, in, right? Interventricular foramen. You know this, and then that's what, this is Sylvius, right? Aqueduct, cerebral aqueduct of Sylvius, and it is opening into this fourth ventricle. All fine. This, and this, three structures, right? They are now on strike. Very interesting structures. For this, we need to understand first that there is something what is called as the recess, right? Recess, a space which is given, right? So these ventricles, right, they project into those spaces, right? They project into those spaces. So here, this one, right, that is what is called as the supra optic recess, because it will we'll see that, right, because actually it will go into that space. This one, this is infundibular, right? Now you remember infundibulum was what? Infundibulum bullier, infundibular, right? Infundibular recess, which was like infundibulum, then pituitary stalk, that was a pituitary stalk. And this posterior one, right? That posterior one, this one. So that is, there are in fact two. One is the pineal and then there is a suprapineal recess, right? So this is like a suprapineal recess. So these are like just the extensions, right? And over here, there would be one opening, right, which will be released, and then there would be two laterals. So those laterals, which will be on both the sides, they are Lashka, and one which is medial is the Magendie, right? We'll actually see this foramen. Yeah. For the cerebral aqueduct of Sylvius, we'll write very clearly that choroid plexus not present, right? Yes. Now see, we said that this is the point, that is the interventricular foramen of Monro, right? So that means it has to open. I will just write Monro, right? You'll get it. So it has to open in third ventricle, right? So that's right. This one, you are so right. This is the third ventricle. Stop. Right? It has to go like this. It has to go, in fact, like this. Let's see if there is a zoom figure. Otherwise, say I'll just mark this, right? This is third ventricle, right? And for the image, I'll just write 3 over here. So this is a midline section which is passing through third ventricle. And this one is the zoomed one, right? This is what I was waiting for. See how nicely, first thing first, this is that Monro, right? And the most fantastic thing what we are watching over here, right? That is choroid plexus. This is choroid plexus, right? And that is what produces CSF. So you remember I was telling that this in third ventricle there is choroid plexus, and that choroid plexus via interventricular foramen of Monro will go into the lateral ventricles and they will also start producing CSF. That's it. This is over here. This is the something that via this interventricular foramen of Monro, then it will be entering into the lateral ventricles, right? So that's how it really goes. So now you can really appreciate that where exactly is this entire third ventricle. See, all the way, right? All the way, right? All the way. It is over here, and it is, this is third ventricle's area, zone. And this third ventricle is opening into a small one, right? See the nice small duct, right? So that duct, this one, is Sylvius, right? Now so they have become like our friends, Monro, Sylvius, Magendie, Lashka. Right? So, but do speak in exam, right? Cerebral aqueduct also, right, of Sylvius, and that is interventricular foramen, you know that. And this one is third ventricle. Okay, so this is like the camera has been shifted slightly, right? So this, and over here we are watching that aqueduct of Sylvius along with the fourth ventricle. So, this is the third ventricle, right? This is the third ventricle. Right, let's change the color. This is the third ventricle, and then it opens into this small duct, right? That duct goes all the way, and then this widens, right? And this one is fourth. That is the fourth ventricle. Yes, right? So this is the fourth ventricle. Now in this, we have shifted the camera still down. Over here, the best thing what we watch is this. Can you see a foramen, right? See this one, right in the median. This is the median aperture. Median aperture. And that is where the Magendie was hiding, right? This is the median aperture of Magendie. Where is Lashka, right? That is deep onto the lateral side, right? It is somewhere over here into the lateral wall. That is where the lateral aperture would be there, right? The Lashka. Now, if we really want to see that, right? See this. Still, when we rotate it, now this Magendie is seen very nicely. This is the opening, right? That is because this is right in the center. So this is where the Magendie is, right? The median aperture. To have a still clear look, you remember I told you that, do remember when we started the discussion, superior medullary vellum and inferior medullary vellum, right? A very thin, delicate structure, and this is what we said as inferior medullary vellum. Correct? That's what we said. That foramen of Magendie, so nice here, and foramen of Lashka here. That's where they open, right? So this is foramen of Magendie, and see on the lateral side, right? Similarly on the opposite side also, that is foramen of Lashka. L is for lateral, M is for median, right? But this structure is again, we have cut something, what? Cerebellum. So let's put the cerebellum. So when we put the cerebellum, right, this means though those foramens, they were opening over there, but actually, right, that medial, it it will come out here. It will come out here. Right? So medial opening, it comes out between two cerebellar hemisphere and the medulla oblongata. That's where median aperture opens, right? And what about the lateral? Lateral one, say now we know these peduncles so well, right? We know these peduncles. So just underneath the peduncle, that's where the lateral opens. So lateral aperture opens just below, just below cerebellar peduncle. Fine. Yeah. And now it is much easier because that's where they open. This is where they open, and then all the way from here starts their journey through those cisterns, right? And it gets circulated all the way. Right. So these are the openings. These are the openings, and we said that during the discussion of subarachnoid, these are the cisterns where there are dilated spaces. That's where these open, and these are the subarach space, right? And then all the way from here, it surrounds brain and spinal cord, right? It surrounds brain and spinal cord. All easy, right? Now this is like underside of brain, and you know almost all the structures, right? This is what was there into the floor of third ventricle. So in the floor, this was the floor of third ventricle, and in this floor of third ventricle, right, say you know this part, so that is number two. Will just write two, right? You know that this is optic tract, and where they join with each other, right? They crisscross. So that is called as the optic chiasm, right? That is also known to you. And then those are like optic tract, right? So these are like optic tract, right? In between what you are watching, in between, right? This is interesting. This is infundibulum. Infundibulum. This one, that opening, that is the infundibulum, right? And these very smart, those nerves, this is, that was two, so this has to be three, right? It is the oculomotor. This one was optic, right? So that's how, say, these are the things which are arranged. Say a very fine structure, very superb structure. This is what? Mammillary bodies, right? You should never forget this structure, because it is this structure which is taking care of your memory, right? So this is mammillary body. In fact, say, I think it won't take much time. Let me add one page. Because if you really know this, one or two pages might be. Just a minute. Okay. Why I said, say I'm taking this a small topic. Mammillary bodies, they are extraordinary thing, right? Extraordinary thing, very interesting, because they are part of what is called as the Papez circuit, right? This Papez, it has not done any pap, but this is the Papez circuit which you must know. Papez circuit, as I said, that in brain everything is in the form of, say, circuits, right? So it is this, what if anything goes wrong to this mammillary body, right? What would really happen? The interesting thing is that if these mammillary body is damaged, what it would lead to, it's called as the anterograde amnesia, right? It is anterograde amnesia. Anterograde amnesia means it's not like that, Gajni. It's like that all those fresh memories, they are not recorded, right? So nothing new, right? New episodes, new episodes, they are not recorded. Old things, they are all fine. These new episodes, they are not recorded. Right? So that is what, and why this thing should happen, that is because of that Pape's circuit. Right? Now in order to understand this Pape's circuit, let's say this is corpus callosum, right? On top, we'll try to use different colors. So there is a structure what's called as the fornix, right? That is the fornix. Our mammillary body is at this location. Mammillary body is at this location, and then it will get the feeds from thalamus. It will get the feed from tegmentum, right? So just remember, these are the, just it is this much only, that there is tegmentum when we'll be talking about in physiology. So this is thalamus, and this is what is called as the fornix. Now see how interestingly everything starts. This area is what is called as the hippocampus, right? This one is hippocampus, but that's it. Entire game would be played between them, right? So see, the memory, it always starts with hippocampus. Hippocampus, because this say mammillary body, it is associated with so many things, right? It is even associated with all those reward behavior, right? That means you do something, and then when you win, so then we say yes, right? So that reward behavior, that goal directed behavior, that is all because of this mammillary body, right? So it starts with that hippocampus. So it starts here, that memory thing. Then this hippocampus, it would generate those theta waves, right? With those specific neurons, they are called as the CA3, right? These CA3, they will generate theta waves. Now that would travel through fornix, right? That would travel through fornix, and it will reach to mammillary body, right? So it is like this path, right? That is how it will reach to mammillary body. So we'll just write M body, right? And you have to write fornix here, right? Or with yellow color, all right. So this is the fornix. So via fornix, it reaches to that mammillary body, and then it reaches to one cortex. That is what is called as the cingulate cortex. Now this thing once again passes via anterior thalamic tract. That is via this thalamus, right? So here it is thalamus. So this is the anterior thalamic tract, right? So that new, it goes via it. Then from there it goes to one more, that is called as the entorhinal, and then it lands back into the hippocampus, thus enhancing the memory, right? So because memory body is one of the important components, so if anything goes wrong, it will stop that new memories registration, right? That is what is stopped, because this M body, and that's what I was telling, that it is that reward behavior, right? This is what I really like. It is the reward behavior. That's what is responsible, right? And that's why it is emotional assisted. Definitely, right? Definitely it is emotional assisted reward behavior, all goal directed behavior. These are very, very typical words which tells the entire story, right? These are like those keywords, right? Okay. Yeah. So we were talking about that infundibulum, right? So here it is another section. Why to leave anything by chance? So this is infundibulum. Infundibulum. right? Or the stalk. It is also called as the stalk of pituitary fossa, of the pituitary body, right? Pituitary gland. So this pituitary gland, it is also called as the hypophysis, right? That is another name. So hypophysis, and it has got two parts, anterior and posterior. So here it is anterior, and there this is posterior, right? So that's where they are lying, right? Anterior and posterior, and that's the stalk which will be passing through the dura. And over here on the top, over here, this entire area is what? That's the third ventricle, right? That is the third ventricle, correct? And what is this white structure? This one, that is optic chiasma, right? Because this section is going right in the middle, right? So that's the infundibulum. And if we zoom out, right, what we really need to see is only one thing, and this is like say pituitary, right? So it is sitting exactly on sphenoid sinus, right? Sphenoid sinus. And this would be the location, because see, this pituitary is controlled by that hypothalamus, so that's the location of hypothalamus. Hypothalamus, right? So that's it for today, right? So do revise this, and tomorrow we'll start from this point onwards. That is when we'll talk about the brain. The nerves would emerge, and then we'll follow them all the way, with chief guest being trigeminal, right? So thank you so much for your patience, right? Thank you so much. See you tomorrow, right? I'm just saving this file. I'll put it into our shared folder. Take care. Good night, and see you tomorrow. Bye bye.